Alaikum. We'll speak about hand hygiene improvement project in admission wards by using focus BDCA. According to the quality department, they are telling we have to do performance improvement project for our department. So we will make about the compliance of hand hygiene in the admission wards by using the focus BDCA. Focus BDCA will start with F, find. So we have to find the problem statement. The hand hygiene compliance rate in admission wards in Al Wafa Hostel Unaiza has not exceed 66%. So compared to the GCI standard 90%. Our objectives for this project, we need to improve the performance of the hand hygiene within the admission wards staff to be 90% or more within 6 months according to the GCI standard. So our project will stay 6 months. It started in January and finished in June. Number 2, O, organize. So we have organize the team. Composition of quality improvement team for hand hygiene compliance rate. It will be the chairperson, Dr. Iman, she's infection control director. Co-chairman, Dr. Nawal, she's the consultant. And the members, Dr. Ahmed Khairi, the head of Obigaini. Dr. Manal Hassanin, she is the quality. And Mr. Hamad Garwan for human resource, because we need staff. We have a shortage of staff in the project. Engineer Al Gabri Abdul Hamid, he is the general maintenance, because we need to construct new things for hand hygiene, for hand washing, so he has to be in our project. Mrs. Abir Kamal, stakeholders, أصحاب المصلحة المشتركة, or the person responsible in the area. She is the supervisor of female admission ward. And Mr. Mike Rayyan, he is the supervisor of male admission ward. Mrs. Azza, she is practitioner of infection control. And Mr. Abdulaziz Al Hakim, he is the cleaner supervisor. This one, the team for our project. So we have to understand what we are going on. We have the 5 moments for hand hygiene. When you are doing the hand hygiene, we are doing before touching the patient, before cleaning aseptic procedure, after body fluid exposure, after touching patient, after touching patient surroundings. So this is the 5 moments we are making monitoring for the staff when they are doing the hand hygiene, and the hand hygiene compliance rate depending on the 5 moments. So you have to understand the current flow chart. The current flow chart now, staff nurses enter the patient room. He or she wash his hand. Maybe they will wash, then they will wear, she will wear or he will wear the gloves, or no, not allowed to touch the patient. Suppose not allowed to touch the patient if they are not washing the hands. After washing hands, they will wear the gloves. Contact patient, remove the gloves, dispose gloves in yellow bag. He or she wash his hands. He or she leaves the room of the patient, and this is the end. But in the washing the hands, maybe she will wash or not. If not washing the hand, not allowing to continue the work. This is supposed to be. This is the current flow chart. So our compliance rate in October 2016, November 2016, and December, we monitor, we found our compliance rate 60, 64, and 66. This is the latest, so we have to improve. This is the fishbone. We have to check what is the problems for the compliance of hand hygiene. First, it is the material. The materials, the materials may be lack of wash sinks, maybe lack of liquid soap, lack of alcohol gel, and lack of tissue. Number 2, education and the training. It will be lack of education, lack of orientation, too busy to learn. Too busy to learn, it is shortage of staff, lack of knowledge. And for the staff, allergy to the disinfectant, negligence to hand hygiene, hurry to wash the hands because shortage of staff or stress of the work, allergy to the soup or allergy to alcohol gel, are resistant to change. This is our fishbone for our problem. This is prioritization matrix. We will not go through for this one. According to the priority, I have to deal with I have to take the topics, and I will depend in my plan. For the education, I am giving for education program 5 for most of the items, so I will start with the education. Increase of staff, this one very difficult, it will take time, and it will take a long procedure to hiring new staff. So according to the prioritization matrix, I have to deal with the items. The improvement team meets to draw the ideal flow chart. What is the ideal must be? So we saw already the flow chart before, and what is the ideal supposed to be. First, the staff nurse enter patient room. He or she wash the hand. Maybe will wash the hand or no. If not washing the hand, not allowed to touch the patient. Remind to perform hand hygiene, and he or she wash his hand. So we have to remind the staff to wash or to use the alcohol gel before entering the room. If yes, hand washing done, so we will wear the gloves. Contact and giving service to the patient. Remove the gloves, dispose gloves in yellow plastic. He or she wash the hand, I will wash my hand. Maybe I will wash or not. If not washing the hand, not allowed to touch the patient. Not remind to perform the hand hygiene. He or she will wash the hand and they will leave the room. So this one we add to the improve the compliance of hand hygiene, that we have to remind the staff to wash the hand and using alcohol gel. Then if wash the hand, they will leave the room, and this is the end of our flow chart. The tree diagram for focus BDCA, hand hygiene compliance rate. We are doing education program, monitoring encouragement hand hygiene, adequate supply for hand hygiene, increase the number of the staff. Number one, educational program. So we have to make orientation for new staff, lectures for all staff about hand hygiene, annual orientation for all staff. For the monitoring, it will be monitor of hand hygiene performance and the encouragement of hand hygiene practice. This is by daily round. Madiha, she is the one doing this one. For the orientation, Madam Azza, she is the one doing orientation for new staff and giving lectures for all staff. Annual orientation for all hospital staff. This is done already in our project, and it is documented and recorded in our files. Adequate supply of the hand hygiene. Compliance at the hand hygiene supplies adequate liquid soap, adequate tissue, adequate alcohol gel. This one we are increase the number of wash hand sinks. For adequate soap and tissue paper, we are asking Mr. Abdulaziz Al Hakim. He is the one supervisor cleaner. He is the one responsible to ask the cleaner to fill up all the dispenser with the soap, and tissue will be available. For the alcohol gel, Madam Madiha, she is the one doing round every week to check all the alcohol gel in the hallway corridors, and the nursing supervisor in their departments, they are the one responsible to fill up the alcohol gel bag. They are the one changing the bag of alcohol gel. Increase the number of staff. This is Mr. Hamid Al-Garwan. Suppose he will bring or he will making the process for hiring new staff. This one will take around 6 months to get new staff. This also the planning matrix by timing, the same what we are discussing, but by timing. Everybody will take his time to finish the work. For orientation for all staff, it will be updated every 2 years. Lectures, it will be for all staff. We are making lectures every week for infection control. Annual orientation also, and monitoring of hand hygiene by daily round, Madam Madiha. Adequate liquid soap and tissue paper, Mr. Abdulaziz Al Hakim. Adequate alcohol gel, Madam Madiha, and Engineer Al Gabri, he is making new sinks in areas that we needed. Hiring of new staff after 6 months. This is the form we are using. And after 6 months, our performance improved to be 75. We did not reach yet to 90. So our project will be continuous BDCA until we'll reach to the 90%. This is the monitoring according to the 5 moments. This is our doctors and nurses. 53% they are doing before patient contact. Before any aseptic task, 83. After body fluids exposure, 95.2. After patient contact, 92.8. And after patient surrounding, they are 80.9. but observed that the nurses, they are more compliant with the hand hygiene more than the doctors in the percentage. Finish our projects. Thank you very much.